have started the timer, and here is your question. Right, so if you have read and understood considering this surgical and augmentation, kindly please tell me.
Okay.
If you can identify, what are you looking at, please? First of all, explain that.
Cadaveric picture of dorsum of left hand.
Okay, very good. Yes, left hand. You see there is this one tendon, 3 is pointing at. Can you identify the structure?
Intertendinous junction.
This one?
Number 3 or the nervous?
These are, if you look closely, this is 8, and then it is dividing into 2, and it is being inserted here. So it's not nerves.
It's 8 and
if you could see here, which structure could that be?
Tendons.
Yes, please identify it, please.
Here we have extensor tendon. We can come back to that later.
Okay, good. This is the better answer. Okay, if we come on to the right hand side image, here you see an area. Can you identify the area? Do you know what is it called?
Snap box area.
Yes, please. How is it formed? Can you tell me the boundaries and the floor, please?
We have extensor pollicis longus, which is posterior and medial, and extensor pollicis abductor pollicis longus, and extensor pollicis brevis, which is anterior and lateral, and the floor is scaphoid.
Very good. What are the contents of the anatomical snuff box?
The radial artery.
Okay, very good. Can you tell me, since you already told me, the base is formed by the scaphoid bone.
Yes.
Can you please tell me how would you identify or how would you confirm the diagnosis of scaphoid bone fracture?
We go for scaphoid fracture, first
Oh.
X-rays, and then we can do MRI.
All right. Is X-ray confirmatory?
No.
No, very good. Can you tell me why is it important to know or to find out or diagnose the fracture of scaphoid bone earlier?
Because the blood supply of scaphoid is very crucial.
Yes.
It may be go for AVN.
Very good. Don't use abbreviation, please, in the exam. Arteriovascular necrosis. Okay. Can you please tell me from where does the blood, from where does the scaphoid bone gets its blood supply? From which part? Upper part or lower part?
From the distal part, lateral and distal part.
Okay, good. Can you please identify number 16 over here?
Extensor expansion.
Extensor retinaculum. Can you please tell me the attachment of extensor retinaculum?
Laterally, you have the pisiform.
Yes.
And the styloid of the ulna. Yes. And radially, we attach to the Leicester tubercle.
Yes. So please tell me, yes, how many, yes, yes, how
six
many?
Compartments.
6 compartments are there, and what are the structures which pass through it?
First one is extensor abductor pollicis longus with extensor pollicis previous. Second one extensor carpatalis longus previous. Third one is abductor extensor pollicis longus. And fourth one, we have the fourth tendon of extensor digitorum.
Yes.
Fifth one, we have extensor carpi annualis. And the
Yes.
last one, I can't
Not
remember.
recall. Yes, we'll come back to that one later. Can you please tell me what are the movements which are possible with the thumb joint or with the thumb?
Movement of the what?
What are the movements which are allowed by the thumb?
Yes, we have flexion, extension, adduction, abduction.
Yes, please. Can you mention all the muscles which are causing these movements? So there is
for
flexion,
abduction.
extension, yes, abduction, adduction, and opposition. So you have to
Yes.
tell me all the muscles which are causing these 5 movements.
For
Please.
flexion, we have flexion pollicis longus, flexion pollicis brevis.
Yes, supplied by which nerve?
Median nerve.
Very good. Yes, extension.
And extension, extensor pollicis longus.
And extensor
supplied by
pollicis
radial.
brevis. Both are
Previous
supplied.
also.
Yes, supplied by the radial.
Yes.
Very good. Abduction.
Abduction is
Yes.
abduction pollicis longus previous.
Yes.
Supplied with radial also. Adduction, adductor pollicis.
Pollicis brevis supplied by median. The other one by radial.
Yes, yes. One, yes. Pollicis previous is median and the longest is radial.
Radial,
Okay, so.
very good. Adduction, add. Yes.
Adductor pollicis supplied by a deep branch of ulnar nerve.
Very good. And opposition, very important.
The thinner muscles, four thinner muscle share in the opposition.
Opponent's pollicis, flexor pollicis brevis, and abductor pollicis brevis. All 3 supplied by the median nerve. Okay. Yes. How would you test flexor digitorum pollicis? FTP.
Flexor pollicis brevis.
Yes.
We make resistant against abduction of the thumb. We are talking about flexor pollicis brevis. Yes.
Yes. How would you test the muscle? Yes, please.
Yes, make the patient making his pointing his thumb against the ceiling, and we can resist this while his palm is facing to the ceiling. Okay,
can you please tell me? Right, we don't have next, if we can wait. Yes, if you can identify the picture A, if you can please, for this image, if you can identify 2 things, I would want you to. 16, please.
Median nerve.
All right, and then 25.
It's ulnar nerve.
Can you tell me what is the sensory distribution of hand by the median nerve?
From palmar, it supplies a palm, lateral 2/3 of the palm, and the palmar side of 3.5 fingers, lateral 3.5 fingers, and the tips from the dorsal.
And the middle and thumb. Dorsum of the tip of middle, index, middle, and thumb. Okay, can you please come over here on the right hand side image? If you can identify this number 30.
This superficial branch of radial artery.
Please look closely. 30 is?
30, we have radial artery, and this is
superficial
palm. Yes, superficial palmar artery of the radial arch.
Okay, isn't it flexor retinaculum?
30.
30,
or
yes.
19.
30, 30.
30 is artery.
With my cursor, and then you have to identify 29 as well, please.
Superficial palmar artery.
Yes. 31
is ulnar artery.
Okay, yes. 27, where is my cursor? Yes,
27.
27 here. Yes, please.
It's radial artery.
Okay. Can you please tell me what are the features of ulnar nerve injury at the wrist?
Ulnar nerve injury at the wrist.
Yes, please.
This lead to complete injury or complete paralysis of the interosseous muscles and the lateral two lumbricals, and loss all intrinsic muscles of the hand,
Good.
and also loss of abduction of the thumb.
Yes. All right. Good. Thank you. One question you can maybe tell me about the carpal tunnel syndrome, if that was the carpal flexor retinaculum.
Compression of the median nerve at the level of flexor retinaculum by transverse ligament.
Very good. Okay. Yes, that ends. Very good. Thank you.